Hello, my name is Klaus Metter from Göppingen, Germany. Our clinic is a teaching hospital of the University of Ulm. My dear colleagues are from Switzerland, Patrick Aepli, Lucerne, and Remus Frey, St. Gallen. From the UK, Bu Hussein Hayé, London, and from Germany, Franz Ludwig Dumoulin, Bonn, Günther Farin, and Karl Ernst Grund, Tübingen. Günther Farin, sadly, has recently deceased. The title of our paper in endoscopy is Endoscopic submucosal resection, ESR, a technique using novel devices for incision and resection of neoplastic lesions. We think an ideal endoscopic resection technique should combine both optimal control of lateral resection margins and resection of the largest possible amount of submucosal tissue without increasing perforation risk. Regarding these requirements, the novel devices have been developed. We were highly interested in whether these theoretical considerations could also be transferred to everyday clinical practice. This case series included 93 lesions from different GI localizations: stomach, colon, and rectum, with a median size of 29 millimeters. ESR was visible in all cases. En bloc and R0 resection rates were 70% and 63% respectively when mucosal incision was done before application of the device for deep submucosal resection. We observed only 3 complications: 2 delayed bleedings, 1 microperforation. The handling of the new instruments showed to be easy and effective. The resection time after incision being less than 1 minute. We present for the first time data from a relatively large multi-center case series using novel devices for resection technique called endoscopic submucosal resection, ESR. Resection close to the proper muscle layer may lead to a better preservation of the submucosal layer, facilitating histological evaluation of submucosal invasion depth in cancerous lesions. A prospective randomized study to systematically evaluate precut ESR versus precut EMR with particular emphasis on the quality of the resected submucosal layer is underway. The series demonstrates feasibility and excellent safety of ESR, using 2 novel devices for block resection of early GI neoplasia. The technique holds the promise of combining the ease of EMR with the advantages of ESD with regard to higher en bloc resection rates for lesion sizes between approximately 20 and 40 millimeters. I would like to thank especially Günther Farin, who has developed the devices.